In this video, I'm going to talk about treatment of headaches and related neck pain, and I'll talk about it from a sort of a spinal approach, if you will. Now, we get a lot of patients that come in with neck pain and associated headaches, or headaches with associated neck pain, i.e. headaches being the primary issue. And when we look at them on the scans, and bear in mind this is just our experience, there may well be some research associated with this, but this is our experience to hopefully benefit you. When we look at their spine on scans, we frequently see some element of spinal misalignment in these patients. And I'll explain why that's a problem. Because if your spine, which should have a nice smooth curve like so, has a neutral position for the head, the blood vessels and the nerves that come out of this region of the spine, just below the skull, have a free passage, they've got a nice lot of space, the muscles are effortlessly holding that skull in place, so there's no balance issues, there's no extra stress and strain on that region of the skull. And therefore all of this region around the back of the head is fine. But the problem happens is when you irritate these joints, these nerves up here and some of the blood flow, you start to get discomfort on the back of the skull, coming around to the front of the skull, sometimes pain behind the eyes, and that generally is coming from here. It's also called a cervicogenic headache or sometimes a tension headache. In patients with these sorts of headaches, we find quite a lot there's something wrong here. For example, the head going forwards and not having its normal curve. In this particular position, that person, the act of everyday life, they have to go like that. And what does that do to this space here? It restricts it. It puts constant compression just for them to look straight ahead and go about their daily life normally. Why does it get like that? We're seeing more and more people are spending lots and lots of time on their smartphones, semi-recumbent in bed, slouching, reading, or watching Netflix on the laptop, those sorts of activities. And those start to create remodeling in these ligaments on the back here, so they lose that integrity. And then it starts to have a permanent or semi-permanent impact on the neck itself. And you don't tend to notice this straight away, it's something that builds up over time, but we are seeing it rather frequently, and we're seeing it, unfortunately, more in younger people that have grown up with smartphones. So you want to be very mindful of this. The other challenge with this sort of case is that people who don't have a full understanding of x-rays and how the head can move forwards will sometimes assume that the patient's neck is doing that and they're slouching like so, and therefore recommend the classic one which you might have seen online for headaches is doing a chin tuck, pulling the head back. Now for that patient, that would be fantastic. It'll take the pressure off the spine, it'll decrease the pressure at the base of the skull and help the headaches. But, and this is generally in more slight individuals, thinner individuals, if you're in that position, this exercise is going to make you worse and not help your spine whatsoever, because it doesn't instill that normal natural curve again and therefore decrease the pressure here. It just puts the whole thing in a different position, but equally bad for different reasons. So you have to be mindful of how you're approaching your neck when you're talking about headaches and treating those headaches. What you'd really need in this instance is something that is going to take pressure off the spine, so a more longer term strategy to reinstill that curve in the neck, so that allows you every day, not just in a treatment, to have a better space here, so that you're not irritating the nerves every day that are giving you the headaches. And also in the treatment that we do here, one of them in particular, decompression, is particularly helpful just by virtue of the way in which it works, because it cradles your skull here and gently stretches, which has an impact particularly on the discs here, but also just opens out this area, which for a lot of people with headaches, they find it instantly relieving. So it's something that you really want to bear in mind when you're getting treatment for headaches and the associated neck pain. Does the person that you're seeing adequately understand the detailed spinal mechanics in that region of your neck? And are they able to influence those in any way? If not, they need to explain why. And if they are able to influence them, can they do some treatment that complements that and give you exercises, a rehabilitation and a strategy for getting back to a normal position? Because in the overwhelming majority of cases, it is actually possible, even if you're in a bad position, to get yourself better so that you don't have those chronic long-term headaches or migraines that people suffer with, which can really get you down and affect your day-to-day life. Thank you for watching. For videos on our Back in Shape program and how to get involved in that and work out from home to strengthen your back, click the link right here. For more recent uploads, then right up here. And if you want to subscribe so you don't miss any of our future videos and stay up to date with the latest back care advice, then subscribe to us above. Thanks again.